I want you to imagine the following scenario. It's 7:30 a.m. in the morning and you're ready to go to work. Normally, you drop off your son before going to work at school. He's 7 years old. However, this morning it's different. Your son has developed a rash on his left arm. Is he ill? Is it serious? Is it contagious? You might want to see a doctor, but who knows that you will be able to get an appointment. So maybe you take him to the local clinic and see if they can squeeze you in. Either way, you or your spouse will be missing a day of work, right? So what if this could be done differently? What if a health insurance provider gives you an app on your mobile phone where you can search about this rash, where you can maybe activate a conference call, a video call, or you can maybe even make an appointment with a medical professional this morning. If you think this is the future, it's not. In today's world, there are health insurance companies providing this service, and we'll see later in this presentation a very good example of this. Welcome everybody, good afternoon. My name is Robert van der Klauw. I'm with Munich Re, which is a global reinsurance company and an insurance company. I'm also a fellow member of ACCA, the Association of Chartered Certified Accountants, and also a member of ACCA's Global Technology Forum. The key point that I would like to make today is technology is set to revolutionize healthcare, and health insurers are the key to the health insurers are the key to enabling this in a cost-effective way, in a way where you reach more people, in a way where you can do this in a more effective way. So we talked about telemedicine. I think that was the example that I was trying to give. Let's move to nanotechnology. So nanotechnology is about the science of small particles. And today, this is supposed to revolutionize the delivery of medication. Magnetic particles, together with a sensor, can identify cancer cells more precisely by a doctor today. Exoskeleton robotics allow paralyzed patients to walk again and to be independent. But also robotic surgery will be more precise in terms of delivering what today a doctor's hand can probably deliver. Genomic medicine, does anybody know what genomic medicine is? So this is the science of using genetic information. And today there are cancer patients that if they have a specific gene mutation, they respond differently to medication. And knowing that information will allow to tailor-made medical treatment and increase survival rates. Tim Cook, Apple's CEO, mentioned earlier this year, that healthcare or making an impact on human with healthcare is going to revolutionize the world. So it's not the iPhone, it's not the iPod that is going to make an impact, according to him, for Apple as a company. And the company is making multi-billion-dollar investments today into healthcare, into wearables. And if you know, the Apple iWatch today has a heart rate monitor. It also has an ECG monitor. And it's able to detect irregularities in heart rates and possibly able to predict at some point in time if somebody's going to get a heart rate or not, a heart attack or not. Does anyone know what this is? Nobody? Okay. So this is the first 3D printed heart made from human tissue. It was released in April this year. It's complete with cells, blood vessels, chambers, ventricles. The cells actually are able to work, but they don't work together yet. So this technology is set to revolutionize healthcare. So what does that mean for healthcare spending? Any idea? Well, the future of healthcare will be costly. And I put here a few statistics here. Today, the world is spending on average 8.8% of its GDP on healthcare costs. That's a mind-boggling $7.5 trillion that is spent in 2018 on healthcare. I think what is more interesting, that these costs are predicted to go up this year by 7.8%, and they exceed general inflation by 4.9%. Let's look at these numbers for Pakistan. So the future of healthcare in Pakistan will also be costly. The country spends actually a modest 2.8% of GDP in 2016 on healthcare, and this statistic is more common for developing markets. But actually these costs are predicted to rise by 16.5% this year, predicted by Aon, a risk consulting company, and that's definitely much higher than the average inflation in this country. So who's going to pay for this? Well, who's going to pay for this? In Pakistan, most healthcare spending is out of pocket. Actually, 2/3 of expenses are paid by individuals and not covered by any private or social security kind of coverage. Yeah? The share of insurance premium is only 6% to finance these healthcare costs. I think what is more interesting to know is that in mature markets, the insurance industry finances a significant part of healthcare expenditure. So obviously healthcare provides protection against the risk of illness or accident. However, at the same time, I would like you to realize that the health insurance industry is a major provider of financing for the healthcare industry, 23%. So this brings me to my key point for today. So technology is revolutionizing healthcare, and the insurance industry holds the key to healthcare's digital future with lower costs and better and more accessible care. I'm going to show you 3 examples, 3 cases where the insurance industry, shapes the future of healthcare. So the first one, I think, connects with the previous speaker, is chronic disease management. In the United States, 86% of healthcare spending relates to chronic diseases. Obesity leading to heart disease, to cancer, to diabetics. These are a major, let's say, cost for the healthcare industry. Insurance companies have developed programs to improve health, to try to prevent these type of diseases, but also treat them continuously. The objective is to obviously improve the patient's condition, but also for an insurance company, quite important, to reduce claim costs. The data that is collected along the way provides useful insight to the patient and the insurance company, including that it builds loyalty. Including that new products can be designed by insurance companies and are offered to maybe people that are previously not insurable. So let's take a look here. I've took an example of global insurance company Akhai in Hong Kong that has designed a diabetes management program, and I'm going to show you a short video. You have to turn on the
understands
volume.
That there are customers in the market not being covered by certain insurance protections because of their chronic conditions or unhealthy lifestyle choices. Therefore, we rolled out an innovative insurance initiative, AXA Better Me, with our breakthrough in underwriting approach, inclusiveness of protection, and all-round health management programs, which aims to improve your health, especially those who are facing chronic conditions or living unhealthily. Customers can manage and control your conditions efficiently, allowing you to live a healthier life. In 2018, we joined hands with Asia Diabetes Foundation and GEM VCare to launch the first-to-market health management program, AXA Diabetes and 3 Highs Management Program. The program provides a year-round health monitoring service to our customers, with customized dietary regime consultation and physical training advice. The condition of your diabetes and the risk of 3 highs shall be managed. After completing the body check, a professional medical team from the service provider would compile a health report and a personalized health management plan, enabling you to manage your health conditions effectively. Upon completion of the one-year program, eligible customers who accumulate certain program points without the need of post-program body check can enjoy a one-off 15% premium rebate. More importantly, customers will be able to embrace the knowledge and skills in health protection throughout the self-help management journey.
The second example I wanted to explain to you is telehealth. I gave you the introduction about this. So telehealth essentially expands healthcare and reaches more patients. But I think for doctors it improves actually clinical workflow and practice efficiency. So it is in addition to what a doctor's clinic probably today is offering. It increases revenue, practice revenue, reduces overhead and reduces claim costs. And I guess most importantly, it also improves healthcare quality. So I'm going to show you these two examples. The first one is from Ping An. Now, Ping An is China's largest health and life insurance company, and it's actually globally a very large insurance company. I think it has a great example of good doctor. I think you need to know that in China there's a shortage of doctors. So on average, there are 1.8 doctors per 1,000 people in China, where in the United States this is 2.5 per 1,000, and in Australia this is 3.4 per 1,000. So I think they came up with a very innovative idea here. Are there any medical doctors in this room? Any medical doctors? There's one here. Any other medical doctors? Well, just one. Anyway, this is a doctor in a box. So what does that mean? So Ping An has developed what they call an AI-powered booth clinic. And it is essentially a remote clinic which you can put in any place. It's unmanned, there's no staff in here. And when you enter this booth, you can connect to a doctor in the cloud. It also has a smart medicine cabinet, so it's able to distribute over 100 different kinds of medication. This idea was released in November last year, and this could be a solution for a market like China where there are not enough doctors, and maybe as well, they're not available in all locations. So that's the first example I want to show you about telehealth. The second one is from Cigna, which is a global insurance company. Maybe you can turn on the
Personalized
sound.
video or telephonic consultations with doctors. So why not reserve your appointment today and experience the benefits? You will have secure and confidential access to this service on your mobile device throughout the day. It's quick and convenient, so you can access it from the comfort of your own home, workplace, or wherever you may be. With an extensive network of care around the world, including family doctors and specialists who speak various languages, you and your dependents will be able to access a doctor for non-urgent consultations, from one-off problems to pediatric care, without any additional cost. The doctors will also be able to refer you to a doctor in our medical network, should they feel you need further support. So, whether you're at home or on assignment, you're never alone when it comes to your health and wellness. What are you waiting for? Download the Cigna Wellbeing app and take control of your health.
Okay, it's good to see that our 7-year-old son is okay. He went off playing, as you can see. The last example I want to share with you is micro health insurance. So micro insurance is basically providing simple and affordable insurance coverage to people of low income, really people who are in need and where an incident, an accident or illness would be devastating to the family. What is critical to the success for microinsurance specifically is obviously streamlined administration. It's very difficult for an insurance company to reach out, collect premiums and claims management if this is not done in an efficient way. So I found here an excellent example which is actually from Pakistan. It's a product that is offered and developed by Easy Paisa, which is a mobile payment provider, a digital payment provider here in Pakistan. I think they have a very moving video, so maybe you can put on the volume for this video. I think it's an excellent example.
Nearly 120 million Pakistanis live on under $2 a day. Comprised primarily of blue-collar laborers living on daily wages, this is a population without access to medical care, completely exposed to the risks of life. With dismal penetration of life and health insurance in Pakistan, due to cost, paperwork, or lack of awareness. An estimated 63% of Pakistanis bear medical costs by resorting to debt or liquidation of household assets. In case of death, the toll is lifelong crippling debts for the rest of the family.
Hello, Abdul Ghani. ऐं बच्चनि सां बि प्यार वधीक कंदो पर मूं पे सां बि वधीक प्यार कंदो.
Although multiple insurance companies exist in Pakistan, issues ranging from lack of access to the masses that comprise the bottom of the pyramid to lack of interest due to the risk profile and expected returns from these individuals have kept these insurance providers out of the market. EasyPaisa saw this as an opportunity and sought to reach out to the downtrodden segment of society by providing them with an innovative way of receiving hassle-free and cost-effective life and health insurance plans. With EasyPaisa Micro Health Insurance, by paying as little as $10 a year, patients can avail hospitalization services up to $500 in hospitals nationwide. In addition, income support is also provided to make up for loss due to health issues, something that is very important for a segment that doesn't get paid unless they work. Through EasyPaisa Micro Life Insurance, any person can provide up to $10,000 safety net for his family by simply maintaining a monthly balance starting as low as $20 or higher in their EasyPaisa mobile accounts. In a segment where the death by accident rate is on the higher side, this coverage addresses the deep-rooted fear that millions have regarding the future of their loved ones upon death.
Okay, that brings me to the conclusion of my talk today. I've showed you these three examples where insurance companies try to shape and help the future of healthcare. The insurance industry holds the key to the digital future of healthcare with lower cost and better and more accessible care. So thank you very much.
Thank you.